Diabetes is killing us, not COVID-19. Hi, I'm Ellie Glazer, founder and director of the Surveyor Weight Loss Solution, and I'm going to talk about the most important story you are not seeing in the media. The coronavirus is certainly the match sparking the wildfire of pandemic that we're all going through now, but diabetes is the main underlying symptom serving as the brittle kindling which compromises the immune system, resulting in ICU admissions and death. This is all according to the most comprehensive data just released by the Centers for Disease Control and Prevention. The report, published March 31st, reinforces a sobering reality that we have all known for some time, but is now acutely relevant. The prevalence of diabetes amongst Americans is a national medical emergency. The American Diabetes Association reports that almost 35 million people, that's 10.5% of the entire population, have diabetes, 95% of which are type 2, and another 88 million people are pre-diabetic. Now, although the coronavirus is thought to be typically most severe among the elderly people, anyone of any age with any underlying medical condition are at a greatly increased mortality risk if they contract the virus. The CDC analyzed more than 7,000 confirmed COVID-19 cases across the country between February 12th and March 28th, in which health officials had a record about the presence or absence of any underlying medical condition. Researchers found that of all the patients admitted to an intensive care unit in ICU in critical condition, 78% of them had at least one underlying health problem, with diabetes being the most common. Statistics reveal that 32% of the ICU patients had diabetes, followed 29% with cardiovascular disease, and 21% with chronic lung disease. And what are the leading causes of type 2 diabetes and cardiovascular disease, as well as a host of many other high-risk medical conditions? Unhealthy eating habits and weight gain and obesity. Dr. Joshua Denson, a pulmonary medical and critical care physician at Tulane Medical Center in New Orleans, said nearly all of his critically ill coronavirus patients have a combination of three specific underlying conditions: obesity, high blood pressure, and type 2 diabetes. He told NBC News, "I can tell you that the ones that are doing the worst have those three problems." But COVID-19 is a respiratory disease. Certainly patients with chronic lung conditions such as asthma would be assumed to be most vulnerable to high-risk outcomes. But why diabetes and heart disease? So Dr. Amish Adalja, an infectious disease physician at Johns Hopkins Center for Health Security, explained the answer in a recent interview with the Washington Post. He said, "Diabetes is a metabolic syndrome that involves blood sugar glucose levels and affects how the immune system works and makes it less effective. This is why patients with diabetes are at risk for many infections besides the coronavirus. They often struggle with infections on their skin and soft tissues, with pneumonia and even more serious conditions." And he went on to explain the correlation with cardiovascular disease. Someone already suffering from heart problems cannot take as much strain as the average person, he said. When a patient gets infected with something like the coronavirus, the fever causes a spike in the heart rate. Shortness of breath means that patient gets less oxygen, and people with limited cardiac capacity often go into cardiac arrest. So if you throw a match on a pile of wet leaves, nothing much will happen and the match will quickly burn out. But if you toss it into a drought-stricken forest full of parched timber, you'll get a raging wildfire with devastating consequences. So we want our immune systems to be like a pile of wet leaves. There will always be matches existing in the world in the form of viruses and influenza, with COVID-19 being the most recent and the most deadly. For the vast majority of people, however, it manifests with nothing more than mild to moderate symptoms. But people with already compromised health, their immune system mirrors that of a drought-stricken forest, making them much more susceptible to high-risk outcomes. The coronavirus pandemic is continually compared to a war zone in all of our media reports, and rightfully so. Now, there are many dangers in a battle, such as snipers, ambushes, and aerial bombings, and soldiers have to take the appropriate precautions to guard from each of them, such as wearing helmets, bulletproof vests, and being as clandestine as possible. Did you know, though, that during the Iraq and Afghanistan wars, the greatest cause of injury and death were actually IEDs, improvised explosive devices that would blow up as it was driven over by a vehicle? And a real game changer happened when the Army started reinforcing the personnel carriers with additional metal plates to offer greater protection from the explosion. Now, even with all the precautions, war is still a very dangerous environment, requiring field hospitals and medevac units to be manned with incredibly brave and selfless doctors, nurses, and paramedics to take care of the injured. So what am I getting at with all this? The headlines that we're bombarded with 24/7 are filled with news about recommended precautions such as social distancing and wearing masks and gloves, in addition to the unbelievable efforts of our first responders and healthcare professionals. As well it should be. I'm not belittling, downgrading, or in any way discouraging people from incorporating those directives and appreciating those people. But where are the stories about the metal plates? If diabetes and heart disease are the two leading causes for a compromised immune system and a greatly enhanced risk of mortality if you contract COVID-19, as the most recent statistics from the CDC clearly indicate, why isn't that among the top headlines and most aggressive initiatives being put forward? We're scrambling to create a vaccine, access more ventilators, and provide urgently needed medical supplies as we should be. But what about reversing diabetes and heart disease? Shouldn't that messaging be just as aggressively emphasized? After all, it's already in our hands to effectuate. It's called eating healthy and losing weight. And no, we don't have to make it much more complicated than that. And yes, it can bear immediate results and be a real game changer, just as the reinforced metal plates drastically reduced the mortality of what was before the greatest cause of injury and death from the IEDs. So, is the solution a crash diet or intermittent fasting which looks to shed as many pounds as quickly as possible? Absolutely not. Because if you undernourish yourself, you are still causing an instability in your blood sugar levels and depriving yourself of optimum energy and nutrition. That's why for years, our Surveya solution has been focused on providing a robust and responsible food plan to maintain extended energy, optimal nutrition, and steady blood sugar level on a daily basis, resulting in what I like to call conscientious and consistent weight loss, all without the need for any supplements or surgery. And because of the current crisis that we're all involved in, we adapted our program to guide clients how to eat to optimize their immune system and immediately start improving their blood glucose levels, as well as developing the skills to maintain a healthy relationship with food for sustained success, which is what we all want. Yes, you can make a positive impact on your health right away. Is there any more important time to do so? Once and for all, we have to understand that obesity is not a medical problem. And we have to turn our primary focus away from the drugs, surgery, or other quick fix interventions and reactionary responses to which we're so accustomed. It's a behavioral problem with serious medical consequences, such as diabetes and heart disease. Now, that's not just a subtle semantic switch. It's a seminal difference in the way we address the situation and strive for a solution. The goal is not just to manage the consequences with medication, but solve the problem by changing our relationship with food. Perhaps now we'll take sugar distancing just as serious as social distancing. So like I mentioned, we adapted our very popular and effective online home study program called the Surveyor Signature Series to accommodate for the extended quarantine and lockdown in which so many of us find ourselves. It's a 10-part multimedia video series that walks you step by step through our program for healthy weight loss and long-term success in addressing the blocks of relapse. And it also includes an intake portal that generates a customized food plan, not just a one-size-fits-all diet. So normally you would receive one video a week over the course of a little less than 3 months. But we took the exact same material and now provide it on a daily basis spanning just 14 days. And you still get all the unlimited email support. And because of the financial hardship that most people are finding themselves in these days, we have significantly discounted the price and are willing to create a payment plan if needed to make it as accessible as possible for as many people as possible. You can register right now at the link below this video or call us at 1-888-8-SURVEYOR. That's 888-876-8392. And we'll be happy to work out the details and get you started ASAP. It won't just be a game changer, it will be a life changer. So invest in yours today.